Good afternoon, colleagues. Today, Friday, the 3rd of April. So you'll have seen a lot of information again this week from government on the daily briefings around where we are in this COVID-19 pandemic that we're dealing with. And unfortunately, as you will have seen, there has been a number of deaths and particularly an increase, which is very, very sad. This is, of course, becoming closer to home for many of us in our communities now and in our workforce. We have a number of colleagues in East who have been sick with COVID, some who have recovered very well, and others who are currently being challenged and are in hospital. And I want to wish all of them and their families the very best. What I'd like you to be aware of is that, you know, and I'm sure you are, that the measures that you're all taking are in place to, as government have outlined, and that we're all contributing to trying to manage the spread of this awful virus. This week, there's been a lot of information around our PPE, our personal protection for folks, and I know many of you have had concerns. We've been talking about nationally whether there's enough supply. I want to assure you at East right now supplies are not short. That's really, really important. The other really important guideline that came out yesterday was about the use of PPE, and level 2 PPE is now in place for all patient contact. In terms of FFP3, you will see on our website and on Need to Know in a number of ways you'll have received this around the judgment around level 3 PPE. So I think that is very, very clear, and I know our IPC lead has been sending out a number of updates around that. Staff testing also was in the news this week, and the government have given a huge commitment around increasing the testing. For us at East, I want to assure you we have taken this very seriously, and actually we have played a big part in the last couple of days about sourcing testing for you, because it is really, really important. So in the next couple of days you will see certain areas are a little ahead. For example, Norfolk have begun testing staff faster. But you will see throughout our 6 counties that we will be looking for capacity, and you will be able to avail of that. So I want to assure you it is a top agenda for us. On some good news, I know that many of you right now are either sick, you're in isolation, you're at work supporting everybody in the community, and therefore many of you will have to have your annual leave put on hold. And I know that's really, really difficult. All of us need our annual leave, but at this time it's just not possible with lockdown, and it's a global lockdown, so really we've nowhere to go globally, sadly. However, we gave some thought to how do we support you in this, not being able to take your annual leave. And we've just had a look at our policy, and what we're implementing is that you can buy back 5 days annual leave. There's a whole policy available, and the protocols are available for you to access. There's a window for you to do this and to consider it, I should say, from April to June, about that being able to consider whether you want to take it up or not. It is entirely up to you, but we felt that it would be of benefit for you to be able to avail of that. So please consider it for yourself and decide if it's for you or not, but it's there. I'd also like to continue to thank really many of our staff throughout our business who have stepped up to do different roles. The clinical team, for example, 40 of them have been redeployed either into recruitment, into our call centres, doing all sorts of different roles. And it's really, really important that we thank all our colleagues for doing that. Something else I would just like to bring to your attention, and I'll be bringing back with a lot more detail next week, around the plans for our business to increase its capacity as we move closer to the peak of the virus in our area. And just to say, we will be doubling our fleet in the next couple of weeks. We already have sourced them. We are now working through the resourcing, and I'm talking about people, to man those vehicles, and also the model of care that we will be using those for. I will be coming back to you with much more detail around that. I know you will welcome these additional colleagues into our business. I want to say doubling our business is what we're doing because we need to do it for our public and our communities. But I'll bring you back the detail. A lot of that planning is going on now, and we will be coming back with the mobilisation of that plan next week to help everybody understand what we're doing. This weekend is going to be beautiful weather, and I know it's a real tempter to want to go out, but please don't. Please stick within the guidelines. I will be back in touch with you on Monday. I certainly myself will be staying within my confines, and I know you will too. Thank you.